Good afternoon, everyone, and welcome to this afternoon's webinar organized by the Center for Extramural Studies. The topic of this afternoon's webinar is Artificial Intelligence in the Time of COVID-19. And with us, we have two eminent speakers, Professor Chilitsi Marwala and Mr. Nanda Padayachi. Before I hand over to the two of them to start with the discussion, let me just give a little bit of background. So firstly, a little bit about myself. My name is Tommy Meyer. I am a professor in computer science at UCT, and I am also the director of the National Center for Artificial Intelligence Research. So when it gets time to ask questions of our two speakers, I am in a position to hold them to account and to make sure that what they say makes sense. A little bit of background about the conversation itself. So the context is the following. COVID-19 has often been spoken about as bringing about a new normal. Under conditions of lockdown, our reliance on technology for human interaction has increased dramatically. Is it possible that the present pandemic will catapult us into a new world of artificial intelligence? And how will this play out in a society as unequal in resources as South Africa? As I mentioned, we have two very prominent speakers to speak to that problem. What I'm going to do is I'm going to give you a quick introduction to both of them, and then I will hand over to our two speakers to give them an indication or an opportunity to tell us what they think about this. So firstly, our first speaker will be Professor Marwala. Professor Marwala is an accomplished scholar with multidisciplinary research interests that include the theory and application of artificial intelligence to engineering, computer science, finance, social science, and medicine. He has an extensive track record in human capacity development and has published 15 books on artificial intelligence. Professor Marwala is the Vice Chancellor and Principal of the University of Johannesburg. Prior to this, he was the Deputy Vice Chancellor for Research and Internationalization and Executive Dean of Engineering and the Built Environment, both at the University of Johannesburg. He was recently appointed as Deputy Chair of the Presidential Commission on the Fourth Industrial Revolution. And then our second speaker is Mr. Nanda Padayachi. He is passionate about using technology to transform businesses and create value. He has extensive experience across financial services, where his focus has predominantly been on the digitization of capabilities for Standard Bank across the African continent, including award-winning machine learning solutions, omni-channel platforms, payment capabilities, card processing, and various other innovations. More recently, he has led the modernization of the data capability across the Standard Bank Group, seeding the next generation data architecture and operating model. He established the inaugural data science capability with Standard Bank Group and currently leads the AI automation and API technology domains, focusing on digital acceleration and innovation. Nanda is an active participant in MIT's CSIR Data Advisory Board and is an MBA alumnus of the Gordon Institute of Business Science. He is deeply spiritual, is an advocate for diversity and inclusion, and a more ethically and compassionate-based existence. So finally, before I hand over to our speakers, let me just thank our sponsor, Standard Bank, who has made it possible for all of us to be here this afternoon. And then over to you, Professor Marwala.
Thank you very much, Tommy, and also I'd like to pay tribute to Nanda for joining me and also for the invitation for me to come and address on this very topical issue of COVID-19 and what AI can do for this. Globally, over 22 million people have contracted the coronavirus. The death tally in the hundreds of thousands. The latest estimates in South Africa are just under 600,000. And while we have seen a relatively lower level of fatalities, more than 10,000 have died in recent months. Economies have been devastated. Companies closures have been rife. Families have been separated and lives have been put on hold. As the first cases trickled into South Africa, it seemed as though it will be no more than an inconvenience for a few weeks, and before we knew it, the virus will be vanquished. That has certainly not have been the reality. Nearly 5 months later, and the battle rages on. In the words of Arundhati Roy, historically, pandemics have found humans to break with the past and imagine the world anew. This one is no different. It is a portal, a gateway between one world and the next. Coincidentally, the pandemic has occurred alongside the acceleration of the fourth industrial revolution. The fourth industrial revolution is an era where technologies such as artificial intelligence are permeating all aspects of our lives and are merging the identity of people and the identity of machines into one. This technology of artificial intelligence has been used quite extensively in almost all areas of our lives. In healthcare, there's been one of the leading industries adopting the technologies of the 4IR. A study by the Lancet Digital Health suggested that the diagnostic performance of deep learning models, which is just a type of artificial intelligence, to be more equivalent to that of a healthcare professionals, with quite significant consequences of the nature of training that we ought to give to health professionals. This, of course, does not mean doctors are obsolete. Instead, AI takes over many of the time-consuming and tedious aspects of the profession. Faster and earlier diagnosis give you a scope to treat more patients. As the coronavirus first began to unfold in China in December, visuals on the use of technology were nothing short of something out of science fiction movie. In a video that went viral on social media in February, an elderly woman in China gazes upward at a drone addressing her. The translation, "Yes, auntie, this drone is speaking to you," garners a slightly bemused smile from her, before the drone goes on to say, "You shouldn't walk about without wearing a mask. You'd be better go home and you don't forget to wash your hands." She heeds the warning and quickly rushes back inside. This was perhaps a realization of some of our deepest fears surrounding the fourth industrial revolution. This, after all, was state surveillance and a curbing of freedoms realized. Yet, in other instances, AI has been an important tool for diagnosis and prevention, and for many simply fighting the isolation. For instance, in Tianjin, a benign new area in China, an AI-supported assistance system to analyze CT images of COVID-19 patients. To date, more than 100 medical institutions around the world have used it. Prior to the lockdown, in the subways in Beijing, passengers were being screened for symptoms of the virus by AI and temperature scanners. Similarly, algorithms are being deployed to screen chest X-ray images to differentiate between pneumonia, tuberculosis, and coronavirus. An AI program has been developed that predicts with up to 80% accuracy which coronavirus patients will develop serious respiratory disease. This can identify early on which patients will likely need hospital beds and which can be sent home for self-care. There are, of course, limitations to current AI technology, which is focused on reading pictorial scans such as ultrasounds, X-rays, and CT scans. Yet these have been proven to be useful tools in managing treatment. AI healthcare startup Diagen, based in South Korea, published a paper based on a deep learning-based model which detects how strongly a molecule of interest will bind to a target protein. In other words, what existing medications may work. It found that the HIV medication atazanavir is the most likely to bind and block a prominent protein on the outside of the coronavirus molecule. Similarly, companies such as Benevolent AI, based in the United Kingdom, are using AI and the available data to score through existing drugs that could be used to treat coronavirus patients until a vaccine becomes available. VIR Biotechnology and Atomwise startups in the United States are using algorithms to identify a molecule that could serve as the basis of treatment. In fact, as thousands of research papers are published on possible treatments for the coronavirus, AI is being deployed to identify patterns and probably routes towards the solution. In March, the United States government launched a project in collaboration with some tech giants and academics to make coronavirus research accessible to AI researchers and their algorithms in an effort to aid health experts. This, of course, is because AI does not work unless there is data. So the availability of data to AI experts is crucial for us to be able to utilize this technology to be able to deal with issues of coronavirus. Elsewhere, the use of AI is combating the coronavirus. In combating the coronavirus has ranged from robotic cleaners spraying disinfectant at segregated wards to AI voice assistants calling people to give advice on home quarantine. In China, the autonomous robots, for instance, have replaced human cleaners, which has reduced infection rates and is also able to work non-stop for more than 3 hours. The voice robot is based on big data and can check information such as personal identity, location, and health condition. It can then categorize information and produce daily reports, which has aided in monitoring the spread of the virus. The robot Pepper, which has been piloted at Nedbank, for instance, has been deployed as a robot companion because of the surge in loneliness during the pandemic, particularly amongst the older population. Pepper can make phone calls and identify missing items in the kitchen. An AI search tool called COVID Scholar was developed by researchers at the Lawrence Berkeley National Laboratories in California to help researchers and clinicians to quickly sift through the vast literature on the virus. This is significant when you consider that COVID-19 Portfolio, a website that tracks papers related to the coronavirus, lists more than 28,000, coupled with just how urgent it is to find solutions. In South Africa, we have also seen the use of AI in the spread of information and for track and trace. As the coronavirus hit South Africa, many flocked to a digital platform called GovChat that connects ordinary people to government services. The service delivery notification service is being used to help people use their mobile phones to notify health authorities and be directed to appropriate health facilities. The data will also assist authorities to identify COVID-19 hotspots at any given time to manage resource allocation. Here at the University of Johannesburg, my student and I have developed an AI tool and the paper was published in PLOS ONE just recently, which is able to estimate vital statistics such as infection rates and incubation rates so that we can be able to tackle this pandemic. At the CSIR and the Department of Science and Innovation developed a dashboard to streamline the data. The information will help government's COVID-19 National Command Council better manage the pandemic. Teaming up with Telkom and Samsung, the government is effectively able to track and trace people who may have contracted coronavirus using data such as geographical information system mapping from their phones. If you have been in contact with someone who has the coronavirus, you can help contain the virus by confirming registration and doing daily check-ins on the Impilo app launched by the Gauteng Department of Health in September last year to improve the patient experience at public health facilities. Despite the successes of AI, there is a growing debate for it to be regulated. I am a member of the World Health Organization committee that is developing guidelines for the application of AI in medicine so that this technology cannot be misused. This is because we know how just risky not regulating AI can be. The AI technology, the technologies of the 4IR are often not guided by policy and are used to pilot new ideas. This, of course, means that there are a great unknowns and potential dangers, particularly given the speed of adoption of these technologies and the traffic and the frantic nature of trying to find solutions to the pandemic. As we make great strides in this period, we have to look at it holistically. For many of us, a pandemic of this nature has not occurred in our lifetime. We have not had to social distance, lock down entire countries, and reconfigure to remote methods of living, learning, or working. It was in 1918, more than a century ago, that we saw the Spanish influenza kill between 50 and 100 million people. As Charles River, editors, wrote in 2014 in a book tracing the history of the Spanish influenza, and I quote, "In many ways, it is hard for modern people living in first world countries to conceive of a pandemic sweeping around the world and killing millions of people. And it is even harder to believe that something as common as influenza could cause such widespread illness and death." This is now our reality. Yet in the fourth industrial revolution, we are far more equipped than we have previously been. Now, as the fight against the coronavirus rages on, AI may be the most powerful tool left in our arsenal. Thank you very much.
Thank you very much for those introductory words, Professor Marwala. And I think what we will do next is move immediately over to Nanda so that he can give us his introductory remarks on this. Thank you, Nanda.
Thank you, Tommy, and thank you to the university for hosting such a critical discussion at this point in time. It's a pleasure to be with Professor Marwala, who's a luminary in the world of AI. And as you can hear from his comments, I think we can all agree that the notion of artificial intelligence being in the realm of science fiction is not the case. We may be the first generation to see artificial intelligence emerge out of the labs, but it's real and it's playing an increasingly instrumental role in many parts of our lives, of the economy and society. There's maybe a couple of comments that I'd like to make to begin with. The first was the topic for today's discussion was framed around what is the implications of COVID-19 in relation to a new normal? And maybe it's worthwhile to reflect that if we think of even pre-COVID, to classify the world we lived in as normal may be, our first challenge to begin with. If we consider the amount of inequality that exists across the entire world, I think we're all familiar with how this plays out in the South African context. If we consider that there's, we're talking around the 4th Industrial Revolution, there's 600 million people in the world today who haven't been touched by the 1st Industrial Revolution. So they live without access to electricity or any form of mechanization. We have 2.4 billion people around the world without access to drinking water or sanitation. We have 1.2 billion people in the world that don't have access to electricity. We have more than half of the world's population without access to internet connectivity. And of course, in the midst of all of this, driven by rampant consumerism, we're reaching the point where our impact as a species is becoming detrimental to the planet. And I guess bringing artificial intelligence then into that context is, how do we then use this to create a better normal? What we want as normal has to be different than what we've experienced in the past. And I think some of the examples that the Professor has highlighted show that how with access to limited resources, the scale and reach of artificial intelligence actually starts to give us far better reach and far better opportunities to address society in a far more equitable way than may has been the case in the past. And if we take a step back and think around, what we're actually trying to achieve with artificial intelligence, at the core, I'd break it down into, 3 specific categories. The first is the opportunity to improve existing, whether it's processes, whether it's services, whether it's existing products, with the opportunity for incremental improvement around that. And we're seeing that play out through, increased automation. We're seeing that play out into when you're composing an email or doing a Google search, there's an autocomplete associated with that. And those are all incremental components of AI. The second category is then how we create new. And many of the, advances that, our professors highlighted talk around how we use these capabilities, whether it's in the context of healthcare, whether it's in the context of agriculture. And of course, the third category is how, it can lead towards breakthrough advances. So whether it's around personalized medicine, whether it's around how we increase the yield from agricultural holdings, not just for commercial enterprises, but for every small, for every farmer. We're already seeing this play out, in many parts of the world, even on the African continent, in Kenya as an example, where through the use of intelligent data, through the form of prediction, through better matching of buyers and sellers, and creating a more efficient use of resources, that we're able to see this a positive impact around artificial intelligence playing out. In South Africa, we have mining as such a substantial sector within our economy. And I was struck recently when I was reading a report around an overseas mining company who was considering making an investment in a new mine because of the poor yields out of their current mines. And they'd always operated their existing mines with existing schedules based on engineering practices and foresight that have been, garnered through generations of people in the workforce. And when they then, took the bold bet to apply some new thinking and apply machine learning into how they could optimize the productivity and utilization of resources of the mines, they found that they were able to achieve a 20% increase in productivity. So without having to drill new mines, without having to deploy additional resources, but just through better optimization of already deployed resources, they were able to make a substantial impact. The last point I'd maybe want to make as part of the opening remarks is that often when we think of these, these newer technologies, we think around it in a private sector context or in a consumer context. I think there's a really substantial opportunity here for these sort of technologies to be used in the public sector. So from government to consumers. So if we think around how we transition towards a digital government, we're already seeing, countries like Estonia making substantial leaps towards that. And, and what COVID has shown us is that as a nation, we can move quickly, we can make bold decisions, and more of those sort of aspects would allow us to be able to serve the people of South Africa, the organizations of South Africa, the entrepreneurs in South Africa to a far greater extent. one of the great powers of, one of the great features and strong use cases around artificial intelligence is its ability to recommend actions. And so the ability to then recommend whether it's diagnosis from a healthcare perspective, who are the suppliers that we should be targeting in a particular context, and having recommendations made on that, and then that being followed up with some human oversight. Those sort of opportunities will really go a long way towards creating a much more equitable society in South Africa, and a society that we all want to be part of. So I'll hand back to you, Tommy. Thank you.
Thank you, Nanda. Okay, so I think what we're going to do next is I'll ask Professor Marwala Chilitsi to for any follow-up comments he would have about what you were saying, and then we're going to reverse the process. Then I'll ask Nanda if you have follow-up questions as well, and after that, or comments as well, and after that we can go into a more general question and answering session. But for the moment, Chilitsi, do you have any follow-up comments about the comments that Nanda just made?
Absolutely, I think Nanda just hit the nail on its head, and I think what we need to assess as South Africans is which in these three general areas that you have categorized AI into. Do we have, economic comparative advantage? Because it is quite clear that we cannot be able to do everything ourselves, and we will have to work with people from outside South Africa so that we can improve capacity. I think when it comes to issues of improving processes, very, very important. But the biggest problem that I see in South Africa is the absence of open data. Like if a student develops an AI algorithm and they want to test it, almost always they will have to go to open data that is located outside the country. Normally, United States, China now is opening some of the data. And really, if you do not have that data, then you do not have AI. I think that is actually quite crucial. Then the second one, how do we create these new solutions? And I think our educational system has almost worked as a constraint towards us coming up with new solutions. I think our educational experience is too discipline specific instead of multidisciplinary. It is clear that for people to be able to exploit AI, it will be important for those people to have been imbued in multidisciplinary education. For example, speech recognition, language translation tools. It requires the understanding of computer science on one hand, and the understanding of linguistics on the other hand. And if you come to South Africa, is it possible for somebody to come and study a degree in computer science and languages, for example? So multidisciplinarity must become a norm for us to be able to be at a better position to be able to create these new solutions that need to be created, which lie in multidisciplinary world. And then the third thing is, how do we produce services and products? And one of the things that I have seen is that we are not bad at creating algorithms that do complicated things. But when it comes to user interfaces, something as simple as user interfaces, because the best products are the ones that will be user-friendly even to those people with minimal technological knowledge. And there's a whole field around creating things that appeal to the eyes, and it falls. That is when technology now starts interfacing with psychology, and so on and so forth. And again, that is a limitation that we need to address, and we can address using a multidisciplinary educational system. Thanks.
Thank you, Professor Marwala. And now I'm going to give Nanda a chance to respond to that and comment on that as well. Over to you, Nanda.
Thank you, Tommy. The professor is so well-rounded in his thinking and his approach, and I think the one point that gets lost sometimes is that we sometimes think that we're going to have this magic sprinkling of AI pixie dust that's magically going to make things better. The opportunity exists. We've heard already how this could be deployed, but it has to be built on a foundation. And the foundation that artificial intelligence is built on is digital capabilities, with data then being the lifeblood of that. And that's actually, the core crux of the third industrial revolution is the whole digitization of capability, with the output of that digitization being data. And so, we have to be very deliberate around, that particular point. And there's, some fantastic work that's been done around South Africa in the digital age, which was, really a really high-level, powerful commission that made a number of, really strong recommendations in this area around how South Africa becomes a hub for globally traded services. We've all seen now what COVID has shown us is that you can work for anybody, anywhere in the world, from anywhere in the world. And so the opportunity for South Africa to take advantage of increasing globally traded services, they forecast that as a sector that could develop from its current state of 50,000 to 500,000 in a decade with the right investment and support around that. And also linked to that is around, how we position South Africa as a frontier for these technologies like artificial intelligence. And I think, particularly as, South Africans and the African continent more broadly, we have such a vital role to play in stepping up and fulfilling that role. The professor made the comment around, where do we have open data? And where do we have data that's indigenous to the people of South Africa and the people of Africa, whether it's around image data, whether it's around natural languages, whether it's around our own environments, etc. And and that plays out in then the biases that that we then see play out around things like facial recognition and the deficiencies around that, because they're built for and designed for a fundamentally different audience. And I think perhaps the one thing we need to consider. There was a really interesting perspective around, countries' competitiveness around artificial intelligence. And, there's a small Nordic country called Finland, which has, a few million people, far less natural resources than we do. And they were contemplating the same question. And they said, well, how do we compete with, the might of Silicon Valley? How do we compete with the might of Shanghai? And they took the approach that as a country, we're not going to try and be the best inventors of AI. We want to be the best users of AI, because this capability gets democratized so quickly that if we're able to deploy AI in as many different industries, environments, institutions as possible, it could be, it could have the effect of the tide that lifts all boats. And so, they went through an expensive program that was created, which is available for free online. It's called Elements of AI, to help the people of Finland understand what is artificial intelligence, what does this mean, how do we use this responsibly, what are the implications of this? And so I think those sort of approaches where there's a much more broad-based approach, we're seeing the same with technology, that yes, there's a very hyper-specialized field where you need PhDs in machine learning and specialization in particular fields. And at the same time, it's becoming, really simple through the capabilities of that big tech provide to us to apply, forecast models to determine your cash flow as a small business without having that deep insight into machine learning. And so that democratization of capability starts to become very important. And of course, as a critical point that we don't want to lose is that the whole purpose of what we do should be to amplify human ingenuity. If all the technology that we have, of all these capabilities that we have, if they don't make us more humane in our thinking, if they don't amplify, the great gifts that we have as human beings, then what is the actual benefit of that technology? And so I think we've got to be very purposeful around being human-centric in how we deploy these capabilities to ensure, again, that the impact is far-reaching and felt by all.
So thank you for that, for those comments, Nanda, and thank you to both of you for providing a very good introductory aspect or part of this webinar. I think you've touched on a whole bunch of important issues. So what we will do now is we are going to move over to the general Q&A session. So I see the questions are coming in fast and furious at the moment. So let me start off with the first question I have here. So as far as I can see so far, the questions that have come in are not addressed to any one of you specifically. So I think what the best thing to do is we'll keep the same sequence that we've kept so far. So I'll ask the question, and then I'm first going to ask Professor Marwala to respond. And after his response, I'll move over to Nanda as well. So the first question here is, speak a bit about the use of AI to monitor patients at home. So this is specifically then in the context of COVID-19. And this includes sending parameters remotely to a central station, for example, a clinic. So over to you, Professor Marwala.
Absolutely. Yeah, of course, one thing that we obviously have to guard against is to guard against the danger of self-diagnosis, because these tools can easily lead to that where people can diagnose themselves. So it is important that when we use these tools, we have to use them with the help of healthcare workers. So, for example, now it is quite possible to to measure, with high definition camera, to measure the color of your nails, and from just the color itself, an AI algorithm can be able to estimate sugar levels in your body. So all these technologies are actually quite available. If we are, I know Discovery has an app which takes all vital statistics about ourselves, and what happens at the background, is that an AI machine creates a signature of you as a person, so that if that signature, there is a drift from that signature, it is a sign that maybe you have to call your doctor and go and check yourself to make sure that you are actually assisted. But now, the biggest problem now is obviously the issue of connectivity, because if we have to create a link between a person who is sitting at home who has this vast amount of data and some AI system that is advising that person to contact the doctor, it means that connectivity, digital connectivity, is very, very important. And it even becomes tricky now that we're in COVID. I'm finding that it is even difficult to download emails because the system has become slower because everybody is in it. So those are some of the issues that we are dealing with. And then the last thing that I wanted to talk about is that one of the recommendations that we have made in the fourth industrial revolution is basically to relook at our laws and legislation, so that they are in line with the fourth industrial revolution. And there are various laws. There are laws around data and utilization of data. There should be laws around privacy, and I think there will have to be laws around how some of these technologies can be used so that we can avoid a dangerous culture of self-diagnosis. Thank you.
So thank you for that. And then over to you, Nanda.
I think that point has been extensively covered. I think what we are starting to see, and that's maybe been one of the side benefits of what we've experienced with COVID, is that as a society, it's forced us to become much more data literate and much more statistically inclined. So we've all heard flatten the curve and have had to understand, what does this mean? We're all tracking these numbers on a daily basis. We're all asking the question of, well, what is this model, and what is this model based on, and what are the assumptions informing this model, and what is the implications if this model is not right? Because we're now starting to see the implications in a very real sense, because it's informing macro decisions as to when do we move from level 3 to level 2, as an example. And I think the increased trust in this capability will become important to ensure that that we can take full advantage of this. The point around digital inclusivity and the barriers to data, absolutely essential. I was reading recently, some statistics from the World Economic Forum, and they were making the point that if somebody in sub-Saharan Africa wanted to watch a standard definition, so not even HD, a 1 hour standard definition streaming program, show, sports event, etc., that would cost 40% of their monthly income. Now, if we talk around how data intensive these processes are, how much data we're going to be generating, the concept of digital twins, as Professor spoken around, that says this is how I exist and this is all my data associated to me and how that gets consumed. This notion of digital inclusivity and creating better access to data for everybody, as for example the government's done recently with access to COVID information, educational information, etc., becomes more and more imperative, because that's the absolute barrier to entry.
So thanks for that, Nanda. Since we are talking about connectivity at the moment, I will go to the next question in a minute. But so both of you have mentioned that connectivity is very important, and I think we can all agree on that. But I think one of the main questions is what is it that we can do at the moment to ensure that connectivity doesn't become the barrier that we know it has the danger of becoming? Is there anything that we in South Africa can do at the moment? And the reason I'm mentioning this is because there's quite a number of questions over here that speak exactly to that. So again, Professor Marwala, maybe you can start off.
No, thank you very much. I think one of the first things that we should do, I think we should issue spectrum, because connectivity requires spectrum. For those of us who are not engineers, what happens is that for the telecommunication company to be able to operate, they need something called spectrum. So spectrum is like a frequency. For example, if you listen to classic FM, there is a frequency. But telecommunications companies don't require one frequency. They require a band. And now, where lies the problem? South Africa has not issued a spectrum in the last 15 years. And because of this, it is increasingly becoming very difficult for telecommunications companies to start to invest in the required technologies that will speed up connectivity. We are living in an era where 5G is here. 5G is faster than the current 4G that we use, which 4G is faster than the 2G that we use. 2G used to struggle with videos. 3G used to struggle with videos. 2G could only do email and SMS and voice. So we need to get spectrum. And then the second thing that we also need to do is to ensure that there is actually real competition in that market. I know the Competition Commission has intervened when it comes to the cost of data, because it's not just the connectivity, it's also the cost of data. I'm amazed by how much my colleagues who are based in the United States actually pay for data, for almost unlimited data, and you compare it with how much we pay in South Africa. And we need to deal with issues of competition. Is it fair competition? And of course, we'll only be able to do that if we start having regulators, lawmakers who are actually technologically literate, which is obviously a big deal, and it interferes into the whole structure of our politics and how we should shape it in order for it to work for us as a society. Thank you.
So thanks for that. And then Nanda, comments from your side?
Yeah, I think the professor has answered this quite comprehensively in terms of what an overarching response needs to be. Perhaps two additional factors to consider that as individuals we have direct control over is the first is given that data is in fact a scarce resource, prioritize how we use our data. So perhaps a little bit less Facebook and TikTok and Twitter, and prioritize learning. I saw a funny meme the other day around machine learning that says all the machines are learning and all the humans are hooked on looking down at their phones. So that's maybe the first thing we can do that's directly in our control. I think the second thing is that of course, the demands of data are going to continue to increase, but where advances in technology could allow for that data to not be, to not consume. So, if we stream an HD movie today, it's 4 gigs of data. How do we get the same effect with that being half a gig of data? So how do we apply, better compression? What are are there newer techniques that could be pursued around that? But these are all secondary considerations. The primary point is just the environmental factors, as the professor has highlighted, need to be addressed as a critical priority.
Okay, thank you. Then moving on, so the next question is related to some of the issues we've talked about now, but I think it's going to look at it from a slightly broader perspective. So the question is, to what extent as a nation can we use AI when our high percentage of unemployed would view AI as a threat? So it speaks to the whole idea about South Africa being a really unequal society and how AI plays into this. So again, Chalitsi, I'll start with you.
Thank you very much. I think one of the consequences of this new era we live in is the fact that because much of our production is going to be automated, mainly because of the developments in robotics, in artificial intelligence, then our workforce is going to shrink. And if our workforce shrinks, then the contribution of people to the taxman is also going to shrink. By the way, Bill Gates thinks in that era we have to tax robots, but I'm not even sure what a robot is, because it's so embedded in almost all our devices that you will have a difficulty determining which one will be taxed and which one will not be taxed. And so these are big issues. But what choices do we have? Because some people say, no, maybe what we should do is to stop this automation. The concept of stopping machines is not new. In the United Kingdom, when the British became the first people to be industrialized, there was a trade union that is known as the Luddites, whose primary function was to stop the first industrial revolution because it was taking away their jobs. Now, if we do not invest in these technologies, South Africa is not going to be competitive. Already we have seen industries that were not competitive that completely disappear. So many of us still remember South Africa in the 80s when shoes and clothes were made in South Africa. But today, none of those things are made in South Africa. simply because we no longer have a competitive advantage. So if everybody else is going to automate and we don't automate, even the jobs that we think we're going to save by not automating are going to disappear. I think the solution should be to reskill our people so that they are able to participate in this new era that is coming. It is clear that three things are going to happen to the world of work. First, some jobs are going to disappear. Secondly, many jobs are going to change. A doctor will have to use more technology in order to do what they do, which means we need to retrain them so that they are much more attuned to technology. And thirdly, new jobs are going to emerge. Data scientists was not a job in the 80s and even in the 90s. Now it is a job. What we need to do is to train our people so that they are able to absorb the new opportunities and the changes that are going to be brought about by these developments.
Okay, so thank you for that. I see that the questions are still coming in fast and furious. So in order to try and get through as many questions as possible, I'm going to slightly deviate from the way we've done things so far, and I'll start alternating questions between the two speakers. So in fact, here is a nice one for you, Nanda. You mentioned in your biography that you're a deeply spiritual person. So here is a question. Could AI eventually lead to the demise of spirituality?
Yeah, so it's quite a philosophical question. I guess in my belief system, and funnily enough, Elon Musk, which I don't think shares the same belief system, tweeted something to this effect recently, in that you don't have a soul, you are a soul. And so it comes to the whole point of it, even if we look at the advances in AI, and now we're seeing, huge breakthroughs with OpenAI and something like GPT-3, which is giving us, great capability around natural language. The reality is, what it's really doing is taking patterns and replaying those patterns in a particular context. But if you look at, even you take something like music as an example, if somebody is heartbroken and composes a song in response to being heartbroken, it has a certain connotation. The fact that an algorithm can now compose a song doesn't quite have the same effect. So I'd maybe answer the question in that context in response.
Okay, thank you for that. An interesting one, yes. Then I'm going to move back to Professor Marwala. So you mentioned a little earlier, you were talking about open data. So here's a question related to that. Why don't we have open data in South Africa? What can be done about it?
Well, I think the reason why we don't have open data is because we are not organized. One of the recommendations of the Fourth Industrial Revolution Commission is to avail and secure data to all the people in our country that will need it, and it is very important that while we avail, we need to secure. For example, I'll give you actually a real life example. Many years ago, more than 10 years ago, me and my student Trevor Ransom were working on an AI system that looks at the images of a brain, X-ray images of the brain. And we got these X-ray images of a brain from an entity in South Africa. And then we realized that those images have people's names. And it's not like something 30 years ago, it's like a few months ago, and you can imagine, So while we are availing, we need to secure. So we need to anonymize. So the reason why we do not have open data is simply because we are not organized. The first thing that we need to do is that we need to have a central warehousing of all the public, of all the anonymized public data. And this will mean that instead of going to build a data center, we come together with a company, maybe Amazon or Microsoft, whichever company that can be able to come, and then we can be able to warehouse this data. And obviously, once you start doing that, there are pertinent issues of standardization. How do we standardize data? Something that we have not been thinking about, certainly in the public spaces. So it is easy. Now, when I come to private sector data, part of the reason is obviously because of competition. That Standard Bank is not going to open up their data because maybe Capitec, might use Standard Bank data in order to outcompete data. So not all data will be open, but some data, the data that should be open, and currently the data that should be open is not necessarily open. Thank you.
So thank you for that. Okay, then we're going to move on to the next question because I see we are running out of time. So Nanda, do you think there is enough being done to address biases in AI, such as race, gender, and other, when trying to solve big problems?
No, so categorically the answer to that would be no. I think I use the example that if you consider the motor car, and when the motor car was invented, to the lag to when the seatbelt was invented, to the lag to when it became compulsory for people to use seatbelts when they're in a motor vehicle, was an extensive period of time. It was almost 80 years. In some countries, it's still not a legislative requirement. The reality is that we can't afford, given how powerful artificial intelligence is, we can't afford that type of lag with artificial intelligence. We have to be very purposeful and very deliberate around designing for this. And what it puts at the core is being very purposeful around to what purpose are we deploying this technology. Yeah, we have to be very mindful of that. The professor spoke around multidisciplinary learning, multidisciplinary teams. I think in South Africa, a unique advantage we have is, our diversity and inclusion as a country, and that has to be manifest in the algorithms that we create and the solutions that deploy AI.
Okay, thank you. Then moving on to the next question, and this one I'm going to pose to Chiliti. So many of the questions we've had so far, all of them have involved AI. Some of them were related to COVID-19 as well, but some of them I think were more general about AI. But here's one I think that is quite relevant for the pandemic in which we are in at the moment, and that is the whole idea of remote working. So the question is, what will the impact be of AI and COVID-19 on the prospect of remote working? So over to you, Chiliti.
Thank you very much. I mean, obviously, the devices that we are using to be able to do what we are doing even now have AI in the background. I mean, just one thing, you probably can see that at my back there is a banner of University of Johannesburg. It's not a physical banner; it is a digital banner. And for the algorithm to be able to separate me from that virtual is actually an AI algorithm. And you probably have seen that it works better on Teams than on Zoom. Zoom, the algorithms are not as fast, and you can almost see it struggling to. This is actually called. They have a name. Is image. The term has escaped, but AI is behind us. So most of the technologies that we use to connect are certainly about AI, and this is going to be the future. I think we have learned that we can be able to do more of these engagements much more effectively online than physically. The last time I came to address the University of Cape Town a few months ago, I had to fly. I had to almost take the whole day to go and give a 1-hour presentation. And it is clear that these things can actually be done using technology. Thank you.
Okay, thank you very much for that. And I think we have come to the end of our allotted time. There are a number of questions that were still in the queue that I had, but I think we have, or I think you have answered the gist of most of those questions. I actually had a number of questions that I would have wanted to ask, but we are running out of time, so I'll leave that for the next time when we meet somewhere. And let me then just say thank you very much again to the speakers, both of you. Thank you very much for giving us your time. And then thank you for Standard Bank for sponsoring this event. And of course, thank you for the audience. Thank you for everyone who took the time to attend this. Thank you very much, and goodbye for now.